Stroke is the 5th leading cause of death in the United States, and yet doctors say many of those deaths could be prevented. I'm Kristen Perfettio. Coming up on Health Minute, presented by Hallmark Health, we're going to talk about stroke, the signs, the symptoms, and the risks. I'm here with Dr. Alec Walker, chairman of the Department of Emergency Medicine at Hallmark Health. And Dr. Walker is going to talk a little bit with us about stroke. So Dr. Walker, first off, what is a stroke?
So a stroke is a portion of the brain that doesn't get oxygen. You got blood vessels that feed the brain and something blocks it, or the blood vessel actually ruptures. When that portion of the brain doesn't get oxygen, it's starved, and then you start to have symptoms. Whatever portion of the brain that was feeding, maybe the speech center, maybe your arm or leg center, you won't be able to use it. That's why some people who have strokes will end up having speech trouble, facial trouble. They can't use their arms or their legs. But essentially, it's that portion of the brain that doesn't get oxygen.
Who's more susceptible to having a stroke?
So tends to be older people, tends to be people who have actually had a long-standing history of hypertension. It could also be a younger person who may have had a primary member, mom, dad, brothers and sisters who've had a stroke.
What are some of the signs and symptoms of stroke?
There's a big push right now for the fast. Facial droop would be one. You wake up in the morning and you see one side of the face is not similar to the other side. That's an indication. Another common is where your arm or your leg is actually dragging. You can't move it. You're unsteady and you're walking. Your gait is a little off. When you wake up and you have trouble speaking, so it may be because you can think appropriately, but for some reason it's not coming out of your mouth appropriately. But those are the big things that you have to say, hey, if I see this going on, or if someone else sees it going on, you got to call 911. And the reason you want to call 911 is you want to get into a center quickly. A stroke center like ours can provide certain clot-busting drugs that can help out. The problem is that there's a timing issue. We have certain window, 3 hours. If we have the opportunity to provide it, a lot of times we can actually reverse. However, if someone, say, has symptoms the evening before, says to themselves, I'm going to go to bed and wake up in the morning, and then they have the symptoms, they're outside that window for some of the opportunities that we can do.
What can someone do to prevent a stroke? Is that possible?
Yes and no. It's not possible right at the moment, but it is possible 20 years before.
Okay.
It's all about eating right, exercising, seeing your doctor. If you're someone who needs medicines for blood pressure control, take them. A lot of people will say, hey, my blood pressure is fine, I'm taking my medicines. Well, so I'm going to stop my medicines. Quite the contrary, your blood pressure is fine because you are taking your medicines, so keep taking your medicines. But the biggest is take care of yourself when you're younger. The latter part of your life will be much better.
It's dropped to the 5th leading cause of death over the past few years. It used to be the 4th leading cause. Why do you think that is? Do you think more people or doctors are becoming more aware of these types of symptoms, or people at home are becoming more aware of what a stroke is?
Everything. It's multifactorial. Doctors are a lot more aware. Our research has advanced. Our ability to do imaging has improved. Patients are more aware of it. There's greater education. What we're doing right now, I think globally, everything put together is probably the reason it's starting to drop down a lot more.
Thanks for joining us, Dr. Walker.
Absolutely.
Appreciate it.
Thank you for having me.